Ever thought about this? What really happens if you refuse an ambulance? It's a situation more of us might face than we realize, so knowing the drill is super important. So, yeah, let's dive into exactly what goes down the second you say, no thanks. Okay, so let's set the scene. You've had a tiny fender bender, maybe you just slipped on the sidewalk. An ambulance shows up, but honestly, you feel totally fine. You just want to go home. So can you just wave them off? Say, hey, thanks, but no thanks? Well, it's actually not that simple. Yeah, surprisingly, the second you say you want to refuse care, you're not actually ending the conversation. You're kicking off a very official, very specific safety procedure. It's something every single EMS provider is trained to do.
Okay, so what is this safety protocol? What does it look like? Let's get into it, starting with what happens right when you say no.
And look, this whole process isn't about them trying to strong-arm you or change your mind. It's all about their duty of care. Seriously, they have this huge legal and ethical responsibility to make absolutely sure you're safe and that you're in the right state of mind to make that call. So, first things first, what do? They immediately go into this information gathering mode. They have to do a full professional assessment right then and there. And that breaks down into two immediate steps. First, they do a really thorough initial assessment. They're paying super close attention to your neurological and mental state, basically checking how your brain is doing after whatever happened. And second, they're going to get a complete set of your vital signs. We're talking blood pressure, heart rate, the whole 9 yards. So really, to boil it all down, this whole first step is just to answer two big questions. One, are you physically all right? And two, is your head clear enough to make what is, let's be honest, a major medical decision? And that second question leads us right into what is probably the most critical part of this entire process, figuring out if you actually have the capacity to refuse care. See, this whole thing comes down to a legal and medical idea called an informed medical decision. It basically means you can't just say, nope, I'm good. You have to prove, demonstrate that you really get what you're saying no to. And that includes understanding all the potential risks of not going to the hospital. So how do they figure that out? Well, they've got this 5-point checklist they run through. First, are you alert and oriented? Simple enough. Do you know who you are, where you are, what time it is? Second, do you actually understand what's going on, what just happened? Third, and this one's a biggie, can you explain the risks of refusal back to them in your own words? Fourth, is your judgment clear, or is it maybe clouded by a head injury or alcohol or something else? And number 5, have you tried or threatened to hurt yourself? You've got to pass all 5 of these, no exceptions, to be considered capable of making that choice. Okay, but what happens when things are a bit more serious or more complicated? Well, this standard procedure has some really important exceptions for those high-stakes moments, and that's when the rules get even tighter. Right, in these high-stakes situations, the decision isn't just up to the paramedics on scene. Nope, they're actually required to call a doctor. It's called online medical direction, which is just a fancy way of saying they get an ER doc on the line for a direct, real-time consultation. And you can see right here how things change depending on what's going on. I mean, look, for the most vulnerable people, we're talking a newborn less than a month old or an infant with a fever under 3 months, that call to a doctor is mandatory. No ifs, ands, or buts. Then you have these other scenarios where it's more of a judgment call, but a strong one. Like if the medic thinks there's a life-threatening thing happening that you don't even know about, or if they suspect abuse, or honestly, if their gut just tells them something isn't right with your ability to make this call, they are really encouraged to get that doctor on the phone. But there is one situation that is completely different. It's totally non-negotiable. If a patient has mentioned anything about self-harm, I mean anything, whether they said it themselves or someone else heard them, the whole standard refusal process just stops. It goes right out the window. Yeah, the protocol is crystal clear on this. It says the patient must be evaluated by a qualified mental health professional or transported to an appropriate facility to receive evaluation. So in that situation, refusing is it's not on the table. The patient's immediate safety becomes the one and only priority. Okay, so let's rewind. Let's say you've checked all the boxes. You have capacity, it's not one of those high-stakes cases, and the paramedics are on board with your decision. Are we done? Nope. The process still isn't quite over yet. First off, they'll still offer to do anything you do agree to right there, like cleaning up a cut. But then comes the paperwork. And trust me, this part is critical for everyone. They have to fill out a super detailed patient care report. And this is not just some formality. It's a legal document. It records everything, their assessment of you, your vitals, and, most importantly, it documents the conversation where they explained all the risks and you confirmed that you understood them. And that official record, that's the final piece of the puzzle. It's so important because it protects you by showing that, hey, you were given all the info you needed to make an informed choice, and it protects the EMS crew by proving they did their job and followed every single step of the protocol. It's that last safety check in the whole system. So, if there's one thing to really get from all this, it's this. Saying no to an ambulance isn't the end of the conversation. It's the start of a safety checklist. It's a professional process designed to protect you even when you're pretty sure you don't need any help. It's all about checks and balances. So now you know the protocol. The next time you see those flashing lights, you'll have a much better idea of the complex stuff that's happening behind the scenes. And it kind of leaves you with a final question to think about, right? What's more important to remember in that moment? Your right to say no, or the safety net that's there to make sure you're saying it for the right reasons?